A cesarean birth story. Despite increasing efforts to reduce surgical births, nearly 1 in 4 babies is born by cesarean in many parts of North America. That is why it is important for you to explore the possibility that you may experience a cesarean birth. Preparing for childbirth and using labor techniques you've already seen in this film help reduce the chances of a cesarean delivery. But sometimes, even after trying many alternatives, surgery is necessary. While most first-time cesareans are not planned, certain medical circumstances do require surgery to be scheduled before labor begins.
Hi, could you tell us where the meeting is, please?
Karen and Paul knew in advance that their baby would be born by cesarean because ultrasound showed that the placenta was blocking the opening of Karen's cervix, a condition called placenta previa. So unlike most people who experience cesarean birth, Karen and Paul had time to prepare themselves. Still, Paul was a little nervous. He had taken a special cesarean birth class and knew he wanted to attend the birth, but he'd never been near an operating room before, and certainly not with his wife as a patient.
Are you getting nervous?
Yes.
It was reassuring for both Karen and Paul to have a little time before the surgery, to become familiar with their surroundings, and to get to know some of the staff. An hour or so before birth, a nurse began preparing Karen for surgery. She listened to the baby's heartbeat, took Karen's pulse, temperature, and blood pressure. A catheter was placed into Karen's bladder to keep it empty during the operation. Finally, Karen's abdominal area was washed and shaved.
Do you have any questions about what's going on that I haven't covered, or any concerns that you have?
Oh, I don't know. I guess I'm just thinking this is it. This is getting close. You know, when all this starts happening.
It'll be over soon.
I'm thinking, yeah, pretty soon it'll be over.
Hi.
How are you, Doctor? Nice to meet you.
You're Dr. Albert's patient. I just told me a whole bunch.
Dr. Levereau, the anesthesiologist who would be with Karen and Paul in the operating room, met with them to review Karen's medical record.
I just want to ask you a few questions before we get going as far as pertinent medical history and things that are going on with you.
Dr. Levereau then described the epidural block, the safest method of anesthesia for mother and baby, which would allow Karen to be alert and responsive when her baby was born. Then he described how the medicine would work and its possible side effects.
Just relax. Breathe
A lot
nice.
of pressure.
Take deep breaths.
Deep
How tall are
breaths.
you, dear?
Paul helped Karen remember the breathing patterns they'd learned in class, while Dr. Levereau administered the epidural.
Just relax.
Lots of pressure.
Just relax. Breathe slow. In through your nose, out through your mouth.
After the epidural catheter was in place, Karen's obstetrician, Dr. Albert, came by.
Okay. What's going to happen now is that we're going to bring you over to the operating room, okay? And Dr. Levereau will dose your epidural even further than he has already. And we'll check it and make sure we have an adequate level, and you're not feeling very much. You won't be feeling very much anyway.
Dr. Albert gave the reassurance that he and the medical staff would do all they could to make the birth the special event Karen and Paul wanted it to be. Now all they felt was excitement.